I'm Dr. Yan Reyes. Let's have free vitamin D. Vitamin D is very important for our immune system. So let's bask in the sun. But I'll tell you how to make it not harmful. First, it's very important to get the UV index. So how can you get it? So in your cell phone, you can see here weather. You press it. After you press it, you scroll down. And when you see the UV index, like in this case, the UV index is 2. So it is very safe. It is very safe. The UV index range from 1 to 11. If the UV index is 1 to 2, it's very safe to bask in the sun. Please don't forget to use a sunblock. For me, I'm using this Cetaphil Sun because I love this because it is SPF 50. It is light gel, so it is not so messy. And I use it for my face and for my arms and some parts that are exposed. It is dermatologically tested. It is non-comedogenic. It is fragrance and paraben free. It is very important for me because I have very sensitive skin. This is not sponsored, but I really love this Cetaphil because it is light gel, see, and it is not messy. So I just place this in my face and in my arms. After sun basking, I use this Cetaphil cleansing bar because I have a very sensitive skin. But usually after my rounds, since I go to see patients with COVID positive mothers and I go to the COVID ICU and COVID NICU, I use this Cetaphil antibacterial soap right after my rounds. It is also very important that you have to hydrate yourself. For me, I drink this blue tea. This is butterfly tea and this has many antioxidants. I drink it before and after I go to sun basking or anywhere. People ask me about my brand of lipstick. I'm using this MAC. And I love this so much because it doesn't smudge. Vitamin D has immunomodulating effects and can lower inflammation. This may be relevant to the respiratory response during COVID-19 and cytokine storm that has been demonstrated in patients with COVID. Studies have shown the correlation between low levels of vitamin D and mortality from COVID-19 was statistically significant. This means that there's an increased chance of death if the patient has decreased in vitamin D. Vitamin D has the ability to suppress the adaptive immune system, regulating cytokine levels, and thereby reduce the risk of severe COVID-19. People who live in the countries like Norway, Finland, and Sweden have higher levels of vitamin D because they have supplementation and fortification of their foods with vitamin D. They also have a lower levels of COVID-19 infection. In the Philippines, we are so lucky because we have the sun, so we have free vitamin D. In most of my patients, especially the newborn, I always advise them to have sunlight exposure at 6 to 8 a.m. for around 15 to 20 minutes to have enough vitamin D. For me, I also have sunlight exposure for around 15 minutes, but I just make sure that the UV index is around 1 to 2, so it will be safe. So guys, get your free vitamin D to boost your immune system. Stay safe, everyone.